Bismillahirrahmanirrahim. Assalamu alaikum. I hope all of you will be fine. I, Izhar Ali Bangish, will be discussing with you this topic. It should be considered as a sort of guidance, and it shouldn't be considered as a substitute for real practical class. This guidance, it is meant for first year BDA students only. By the end of this guidance, all of us should be able to answer these questions. Number one, enumerate various reflexes of eye. Define light reflex and its neuronal pathway. What is the procedure of eliciting light reflex? Define accommodation reflex and its neuronal pathway. What is the procedure of eliciting accommodation reflex? Define corneal reflex and its neuronal pathway. And finally, what is the procedure of eliciting corneal reflex? Reflex can be defined as an involuntary response of the body to a stimulus. Regarding reflexes of eye, there are a number of reflexes. They are light reflex, accommodation reflex, corneal reflex, visual body reflex, vestibulo-ocular reflex, and pupillary skin reflex. Among them, the top three, they are included in your syllabus, and our following discussion will be focused on these three reflexes only. Question arises, what is the importance of these reflexes of eye? Now, whenever we examine a patient for these reflexes indirectly tell us about the intactness of nerve supply to an eye, intactness of various eye paths, and these reflexes, they have got a protective role as well. Light reflex, it is also called as pupillary light reflex. It can be defined as when light it is projected on an eye, its pupil constricts and there is simultaneous constriction of the contralateral pupil as well. It has got a protective role in the sense that it avoids excessive exposure to light. It can be of two types, direct light reflex and indirect or consensual light reflex. Now, it can be explained with the help of this diagram. For example, when light it is projected on an eye, it will constrict as a result. Now, this constriction, it will be termed as direct light reflex. Simultaneously, there will be constriction of the contralateral pupil as well. Now, this constriction, it will be called as indirect or consensual light reflex. The neuronal pathway of light reflex, it starts from retina. The impulses, they travel through the optic nerve, they pass through optic chiasma, then through the optic tract. Some of the fibers of the optic tract, they terminate in the pretectal nucleus. Now, the pretectal nucleus, it sends fibers to Edinger-Westphal nuclei on both sides. The Edinger-Westphal nucleus, it gives rise to fibers which are the parasympathetic nerve fibers. They travel through the third cranial nerve, which is oculomotor nerve, and they terminate on the neuronal cells located in ciliary ganglion. From here, the postganglionic parasympathetic nerve fibers, they travel through short ciliary nerves and they ultimately innervate constrictor pupillary muscle. So, when light is projected on an eye, there will be constriction of pupil on that side, and there will be simultaneous constriction of the contralateral pupil as well. The procedure for eliciting light reflex, it starts with taking consent. Consent should include greeting to subject, then introduction, then inform what you are going to do, and finally ask for permission. For example, if I am asked to take consent, it will be like this: अस्सलामु अलैकुम, मेरा नाम इजहार है, मैं आपकी आँखों का मुआयना करना चाहूँगा, मेरी कोशिश रहेगी कि आपको तकलीफ़ कम से कम हो, इजाज़त है. In case you are foreigner student, you can ask for translation help. Step number 2 will be that you will approach the subject from his right side, and then you will tell him to look at a distant object. Step number 3 is that you will bring the light from behind, and then you will project the light on the test eye while you remain focused on the subject's eyes. Now, as it is shown in the picture, the test eye, in this case it is the right eye of the subject. The light source, it is being brought from behind the test eye, and ultimately the light, it is projected on the test eye, and the examiner, he is focusing on both eyes. So, in step number 3, we checked the direct light reflex as well as the indirect light reflex for the right eye. In step number 4, we will repeat the procedure for the opposite eye, and again we will look for the direct light reflex as well as indirect light reflex. The step number 5, it will be that you will thank the subject. Now, at the end of completion of examination, you will face the examiner and will present your findings like this: in this well cooperative subject, I have elicited light reflex, and my findings are that the direct light reflex and indirect light reflex, both of them, they are present for both eyes. Now, let us discuss the accommodation reflex. It is also called as accommodation convergence reaction. When the eyes, they are directed from distant to near object, they accommodate, they converge, and there is pupillary constriction. Let us discuss accommodation first. In accommodation response, the thickness of the lens, it increases. It is because of the contraction of the ciliary muscles, which decreases the tension on suspensory ligaments. As a result, the lens, it gets thickened and there is increase in its refractive power. In convergence response, the medial recti, they contract. As a result, both eyes, they converge, and this allows the image of the near object to focus on the corresponding part of retina in each eye. Finally, pupillary constriction. Pupillary constriction occurs as a result of the contraction of constrictor pupillary muscle of the iris, because a small aperture gives the optic apparatus a greater depth of field. As shown in this picture, the eyes, they are directed from distant object to a near object, and as a result, both eyes, they converge and their pupil, they are in a constricted state. The neuronal pathway of accommodation reflex, it starts from retina. The impulses, they travel through the optic nerve, then they pass through optic chiasma, then through optic tract, and ultimately reach lateral geniculate body. From here, another set of fibers arises. These fibers, they travel through optic radiation and reach visual cortex. The visual cortex, it is connected to the frontal eye field of cerebral cortex. Some of the cortical fibers, they descend from this area and they synapse on the neuronal cells located in the oculomotor nuclei. The oculomotor nuclei, they in return innervate the medial recti muscles. Some of the cortical fibers, they descend and innervate the Edinger-Westphal nucleus on both sides. From these nuclei, the parasympathetic nerve fibers, they travel through the third cranial nerve and reach ciliary ganglion. From here, the postganglionic parasympathetic nerve fibers, they travel through the short ciliary nerves and innervate ciliary muscle and constrictor pupillary muscle. Contraction of the ciliary muscle is responsible for accommodation, and the contraction of the constrictor pupillary muscle is responsible for pupillary constriction. The first step in eliciting accommodation reflex is to take consent. The second step, it will be that you will ask the subject to look at a distant object, and then you will hold your finger in front of subject's nose as shown in the picture. The third step, it will be that you will ask him to focus on your finger, and meanwhile you will note the convergence and pupillary constriction in subject's eyes, and finally you will thank the subject. After completing the examination, you will face the examiner and will present your findings like this. In this well cooperative subject, I have elicited the accommodation reflex, and I have noticed the convergence and pupillary constriction. So finally, we will discuss corneal reflex. The corneal reflex, it is also called blink reflex. It can be defined as when cornea, it is touched, as a result the eyes blink. Another reflex which is used interchangeably with corneal reflex, it is the conjunctival reflex. The difference is that of the point of stimulation. In case of corneal reflex, we stimulate the cornea. In case of conjunctival reflex, we stimulate conjunctiva. The neuronal pathway of corneal reflex or conjunctival reflex, it starts from the point of stimulation. For example, in this case, there is stimulation of the cornea with the light object, for example cotton wisp, and the impulses, they travel through the ophthalmic division of trigeminal nerve, and these impulses, they reach sensory nucleus of trigeminal nerve. Now the impulses, they are then sent through internuncial neurons to the motor nucleus of facial nerve on both sides through medial longitudinal fasciculus. Now, the motor nucleus of facial nerve, through facial nerve it then innervates the orbicularis oculi muscles on both sides, and as a result the eyes blink. The procedure for eliciting corneal reflex, it starts with taking consent. The second step is that you will make a wisp of cotton as shown in the picture, and then you will lightly touch the cornea or conjunctiva. Okay, after touching the cornea or conjunctiva, the eyes, they will blink. You will repeat the procedure for the opposite eye and will note the direct and consensual responses. Finally, you will thank the subject. At the end of examination, you will face the examiner and will present your findings like this. In this well-cooperative subject, I have elicited corneal reflex and I was able to note the direct and indirect responses for both eyes. The precautionary measures while eliciting these reflexes, they are: subject should be in a relaxed state. While checking light reflex, source of light should be brought from behind the test eye. Care should be taken while touching the cornea in case of eliciting corneal reflex. Okay, in your practical notebooks, you will write the details which I have just explained, and then you will draw the relevant diagrams, and you will also write the report. The report, it should be specified by name of subject, his age, gender, date and time and address, and then you will write the findings in tabulated form. For example, the tabulated form for light reflex has been shown here, and then for corneal reflex, and then for the accommodation reflex. Okay, with this we come to the end of this guidance. Thank you for your attention. Allah Hafiz.